OET speaking. Okay, OET speaking, you marked on language skills, you're marked on clinical skills, isn't it? Language skills, one line is your ability to talk with the right pronunciation, with the right speed, not too fast, not too slow. Clinical skills, you have to be patient, you have to be very courteous, you have to say thank you, excuse me, can I, before every investigation and every procedure, ask permission for them. Be patient, one line. Warm-up sessions, we know that we have discussed once, and I think it's time for me to, repeat once again the warm-up sessions. Probably we'll do it in the next session. I'll give you what exactly the warm-up session is and how to go about. You have the warm-up session which lasts for 2.5 minutes now. That's what they say. Then after that, you will get 3 minutes preparation, after which you get your first role play. And after that, you'll be given another, immediately after the first role play comes the second role play. There, again, you will get 3 minutes to prepare, followed by the next role play. Totally, it lasts for 20 minutes, but don't worry. Even in case if it goes 21 or something like that, or 20 point something, doesn't matter. But you talk and end it peacefully. Don't give an abrupt ending. Conclude well. How to initiate the conversation? I've always told you, see, whether it's a known case or an unknown case, I would say that you can ask the name of the patient during the preparation time. You can ask, how can I address you during the role play, during the preparation time, whether it's a known case or an unknown case. What is a known case? A known case is when you know the patient before, when you know the person, patient. For example, GP, well, consulting a GP, the GP is already familiar with the patient. In a hospital admission case, where the patient is familiar with the nurse, you know each other. Then when you go for home visit, if you're regularly going for a home visit, then again the case, it's a known case. What are the examples of an unknown case? Can you tell me?
Outpatient clinic.
Yeah. Outpatient clinic.
Emergency department.
Emergency department. Good. I thought someone else said another thing. What is it? Who else said something in between? Yeah, community health center, especially. See, again, this community health center, sometimes this person can be a known case. So, for example, we see in some letters, isn't it? Community health center, this patient has been going from 2015 to 2017, which means he's not admitted. He visits there regularly. So, depending on the situation, okay, community health center, generally, it could be an unknown case, but sometimes it can be a known case also. Okay, so what I'm trying to tell you is whether it's, sorry, Nathan, tell me.
Home visit, if first time.
Yeah. Home visit for the first time definitely is an unknown case. Yeah, thank you. See, so what I'm trying to say is whether it's a known case or an unknown case, you have the option to ask the patient's name during the preparation time. But that's not compulsory also. It is optional, I told you. If you ask the patient's name during the preparation time for an unknown case, you need to restate the patient's name when you begin the role play, because you don't know the patient, isn't it? So you can ask, can you restate your name for the record, please? For an unknown case, okay? For an unknown case. You can say, can you restate your name for the record, please? Okay, so did you understand that? And then you begin your role play. Okay, so for the exam, it is very important that you as a candidate should begin the conversation. And so initially you need to introduce yourself by using the setting. For example, the setting will be the outpatient clinic. So how do you address? Good afternoon. Yeah, in India, usually the exams are in the afternoon. So you can say, good afternoon. I'm Deepa, one of the registered nurse in this clinic. Welcome to our practice. How can you introduce yourself? Good afternoon. I'm Deepa, one of the registered nurse in this clinic. Welcome to our practice. You can also say like that. Then, since it's an unknown case, how can you ask? You have to restate the name, isn't it? You have to ask the name of the patient once again. Even if you have asked the patient's name before, during the role play. How can you say, can you restate your name for the record, please? Please write it down. Huh? Some students who require notes, please write it down. Then they'll say, okay, then they'll say your name. Yeah. Then you can say, please take your seat. Then say thank you, all that. See, these are the questions that we discussed. Usually that comes for the warm-up sessions. I'll give you a quick summary. Yeah? These are the warm-up questions. I'll give you a class in detail, but I'll just give you quickly. How long have you been a nurse? So how do you say? See, I'm sure a lot of Malayalis and also the others, they have a lot of experience, but for the time being, probably they'll be not working. So usually what the student says is, currently I'm not working. Don't say that. When you look back, probably you'll have some 8 years, 9 years experience, but you'll be taking a break now, isn't it? But don't say that. Instead, say your background. How long have you been a nurse? Oh, well, it's I completed my nursing from Sayers College, and I have 6 years or 3 years of experience in different hospitals. I have experience in different wards. Say the name of the wards, and I really love my profession. This is so much you have to say. Okay, this is at least you have to say it so much. Then next question: why did you decide to become a nurse? See, let me tell you. Don't repeat the answers. Typical answers which everyone says. You should talk differently from the rest. That is where you get marks. Because I'm sure the examiners are also fed up with the same monotonous style of talking from the candidate. So why did you decide to become a nurse? Talk from your heart. You can say, see, right from childhood, I have seen a lot of nurses in my family, my relatives. And sometimes when I visited the hospitals, I have always thought that nursing is a wonderful profession. So all these motivated me to become a nurse. From that, when you come from one point to another, you can use a linking word like this. Apart from that, today, there are many opportunities for nurses globally, job opportunities for nurses globally. All these persuaded me, all these created an interest for me to join this profession. Say things differently, talk from your heart. Okay. Don't say like how your friend answers. Let your answer be different. Okay, next. What kind of a person makes a good nurse? Here they are asking you the qualities required for a nurse, isn't it? So what do you say? Well, in my opinion, talk like that. A nurse needs to have patience, needs to have, I'm using a little bit of Malayalam, വേണ്ടതാണ്, patience വേണ്ടതാണ്, needs to have patience. They should be good listen. They should be a good listener. They should be, then give one line of explanation. They should be able to listen patiently to the concerns or to the worries of the patient. They should have a strong commitment to their job. And some say they should treat the patient as their family member. So all that is good, okay? Next, tell me about a usual day in your job. See, I don't know your routine. Only you know your routine. But let me tell you, don't say what you do right from the beginning, 8 o'clock till when you leave the office. Don't say that till when you leave the hospital. But you can say something in general. You can say, well, I work in a very busy hospital. So I follow a very busy schedule. We begin our work at 8 o'clock by signing in. After that, or you can say after my usual rounds, we have whatever. I don't know your routine actually. So you can say we consult the patients. Sorry, we do our regular rounds, and then we see whatever you know your job, isn't it? So you can say that. But don't say minute one word. Don't say like that. Okay. Don't say everything. Don't go to the minute details, but just give an overall view. So can I have someone to talk about? Tell me a usual day in your job. I think you can talk much better than me. Betty, can you say something about your regular routine?
Yeah, well, my routine work actually starting at 7 o'clock. And then I am handovering the...
Here, Betty, can you stop using ing? Well, I usually start my work. I hand over. Don't use ing.
Okay.
Okay, say.
Handover from previous shift. Then I started according to that which patient we have to prefer. Actually, I am working as a staff nurse in cath lab. Cath lab means same like operation theater. So we have to do the procedure. So we have to check all the patient, which patient is, we have to prefer first, according to doctor, we have to analyze everything and we have to start the procedure, and we are assisting with the doctor, and we are managing everything as a team leader.
Okay, we are assisting, we assist the doctors.
Okay.
Okay. So don't try not to use ing, okay? And then end it properly, end it. But it's okay. Try.
And the actually normally we are 15 to 20 cases per day, and maybe it will not finish around 2 o'clock. My shift is handovering to around 2 o'clock, and we are giving handover to other shift.
We hand over. Yeah, ring. You have to make note of that. Okay. Try not to use it. Okay, good. Good attempt. Because I don't know your daily routine. No? It's good. We all say that. So we usually hand over, we assist the doctor, and usually sometimes we'll have to deal with with a lot of patients. So sometimes we extend our, we'll have to extend our time. So try avoiding ring, because that is something that is present continuous. But this is something that is habitual, no, every day or work routine. So you can use a simple present tense. Okay, good. Okay, what advice would you give to a new nurse? Well, in my opinion, the advice I would give to upcoming nurses are, can one of you tell me 1 or 2 points? Nasim, tell me.
Well, in my opinion, I would like to advise for a new nurse to be a good listener, because it is very important to listen from the patient side first, so we can deal accordingly.
Yeah, good. Can another
Then-
person take over and say another point?
She
Fast.
should have a good commitment
Okay.
and should
You
be
should have a
good rapport.
strong commitment. Yeah, once again, tell me. Repeat what you said.
She should have a good commitment and should be a good communication with their colleagues and with the patients also, and always try to listen the patients what they are telling, and moreover should be a good carer also.
Okay. Yeah, good. Thank you. Tell me about a recent training that you have done. Here you could talk about any small training in your department which you get occasionally. Talk from your experience, okay? And please, I'm sure you'll have your own training sessions. Talk on that. Talk from your experience. So this is something about warm up. But let me tell you, warm up, you're not marked. Then why should you say the warm up confidently? I think when you say the warm up with a lot of confidence, you have the energy to talk the role play also more effectively. I feel that. Okay. Yeah. See, all this I usually, I've told all these now. When you want to check, when you want to get some information from the patient, you can always ask like this. Can you tell me about your medication usage? I would like to check whether you smoke. I would like to check whether you are having any medication. You can use all these when you want to check or get the information from the patient. There is a disturbance coming from one house. So can you please mute? I don't know which house. Okay. After collecting the information from the patient, when you want to give back information or advice to the patient, what do you say? Then usually in the task, you'll get these verbs as explain, advise, recommend, suggest, discuss. Once you listen to the patient, when you need to give back information to the patient, you can either start like this. Okay, now that you have told me you want to quit smoking, I shall suggest some measures that will help you. Or now that you told me that you have a desire to stop alcohol, I would like to suggest some measures that can help you. Or I would like to recommend or outline meaning explain some measures. Did you get an idea? Okay. Sometimes in some role plays, you can see that the patient may not cooperate because they may not be ready to listen to the doctor or to the nurse. Then in such cases, you see words like this: persuade, emphasize, stress, reinforce, promote, express concern, convince. See, these are the things you as a nurse should do in order to convince the patient. Then how do you say that? How do you begin? The bullet points will always be in the bracket, but how do you begin? You can begin by like this: I understand that it must be difficult for you to change. Understand that you might be reluctant. Reluctant means not willing. You might be reluctant to change your mind. But I wanted to understand that you need to continue your treatment in the hospital, or you need to take the medication regularly. You can say that I understand that it must be difficult for you to change your mind, but it is critical that you continue your medication. Otherwise, it can lead to further complications. Okay, so did you get an idea? I would say if you liked anything, you write it down. Don't write everything, because we just have 2 role plays. You can use 1 or 2, what is comfortable for you. Hey, where is that noise coming from here? Can you all please check and mute? Can everyone mute now actually? Then we can know where it is. There's still, who has not muted? Yeah, right now the problem has stopped. Who muted recently? That is, they are the culprit, okay? Now don't unmute. Okay, reassurance. See, reassurance, that is something I want to tell you, because reassurance is something that we have to give throughout the role play. When, first of all, when you introduce yourself to the patient saying that, well, I am the registered nurse, how can I help you? Then when the patient tells their worries and all these concerns, it is then that you have to immediately reassure them. How do you say? We usually say, don't worry, we are here to help you. But right now, according to the OET recent update, they say that don't try to use the typical phrases for reassurance. Instead, use something different, because they are tired and fed up hearing the same thing over and over again. Okay, so I would say, please try to use something different. So how do you say? There's absolutely nothing to worry. There is nothing to be, there's nothing to be overly concerned. Or you can say, when they tell their worry, you can say, oh, definitely it is a concern, but I shall recommend some strategies to help you. When they say their concern, you can say, definitely I understand it's a concern, but don't worry, we can help you with some strategies. Did everyone understand that? Yes or no?
Yes, ma'am.
Yeah, try to do something different. There is absolutely nothing to be overly concerned. There is absolutely nothing to be overly concerned. We are here to support you. We are here to guide you. All that. Say something different. Yeah. Usually in that every task will have multiple questions to deal with. In one single task, we'll have give information about dash, 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 full stop. Same task you will have advise the patient regarding something, full stop. Same task will have explore any recent incidents. So you have to attempt take them one by one. Okay. Remember to deal with the task one by one. We'll see that in the role play. So this is the role play we are going to deal today. Okay. You have it in your WhatsApp group also, the main Goscore group also. So I'm sure some of you have written, some of them who joined late have not read it. Sorry, read it. So can I have someone to read this role play from the beginning, at least till the background? Can anyone opt to read? I just want the nurse role play part. So should I call the name, or can you all opt?
Hospital ward. You are a 65-year-old patient who has been having treatment for emphysema. You are discussing his or her discharge from hospital.
Okay. So this is a hospital ward, which clearly says that it's a known case, isn't it? Yes or no?
Yes, ma'am.
Can I have a
It's a
response?
hospital
Can I
ward.
have a response? Yeah. See, so you have the option. I told you, you can either ask the name of the patient. Yeah, it's a hospital ward, no? So you know this patient. So you must ask the patient, uh, the examiner, what their name is. How can you say? How can I address you during the role play? You have to ask this during the preparation time. Okay, and what does the background say? You, as a nurse, is seeing a 65-year-old patient who has been having treatment for emphysema. You are discussing her discharge from the hospital. Okay, now can someone read the first task alone?
Explain the reason for seeing the patient, discuss discharge process, find out how the patient is feeling.
Okay, thank you, Asanta. Yeah, explain the reason for seeing the patient. When you're walking into the room, this is the first thing that you're going to say. Explain the reason for seeing the patient. Yeah, the brackets they say discuss discharge process, which means you have come to discuss the discharge process. Find out how the patient is feeling. So you know that this is already a known case. So how can you introduce yourself? Hello, Anu. Good afternoon. I'm say your name. I'm Deepa, one of the nurse who will be assisting you today. You can start differently because it's a time of discharge, isn't it? You can say, well, see, now we are going to see how you can say it differently than the ordinary normal style. Okay. So I'll just give you some suggestions. Since it's a discharge, you can say that if I've come with a good news. So you can begin by saying, good afternoon. I am Deepa, one of the registered nurse who will be assisting you today. Well, I've come here with the good news that you are ready for discharge. Once again, I have come here with the good news that you are ready for discharge. I have also come to discuss your discharge plan. Anu, how are you feeling today? Miss Anu, how are you feeling today? This is how you begin your note. See, this is a very formal speaking, isn't it? So it is good to use the title, say Miss or Mrs. But don't continuously use the name. Once you're beginning, you can use the name, then you can say you, talk like that. Otherwise, sometimes it becomes so monotonous hearing the same name over and over again. So did everyone understand how to begin? Yes or no?
Yes.
I hear only one yes. Oh, probably I've asked everyone to mute, isn't it? That is why. Okay. That's okay. Now, then my answer will be, yeah, I'm feeling much better. I can't wait to go home, which means I'm very excited to go home, I'll say. Then, and how do you respond back to me? Oh, that's really great. That's really great. Then you can say, can someone else, can another person read the second task for me?
Outline steps in discharge process, final check by medical team, discharge of her medication, dosage,
Discharge, no,
frequency.
sorry, you missed one line. Discharge letter from the doctor.
Oh, sorry. Discharge letter from doctor, supply of medication, etc. Establish patient's understanding of her medication, dosage, frequency, etc.
Yeah. So here you can see in one task there are multiple questions here. One is outline, meaning explain the steps in discharge process. Then what else? Establish patient's consent. Understanding regarding the medication. There are actually two tasks. Okay, so how do you say? Then we ended by saying, oh, that's great, because the patient is very excited to go home. So we said, yeah, that's great. You should say, outline steps in discharge process. You have to say the different steps involved in the discharge process, which means there'll be a final checkup by the medical team. After that, you get a discharge letter from the doctor along with the medications you need to have. It is good to use connectors so that it is short, at the same time it's good to hear also. So I shall just help you with that. Well, I shall explain the process before discharge. You will have a final assessment. You have to build up in sentences, okay? You will have a final check. Try to use another word, synonym. Can say that you will have a final assessment. It is there, you get marks, okay? So try to use, if you can. You will have a final assessment by the medical term, by the medical team. Use a connector. After which, Malayalam, after which you will receive a discharge letter from the doctor. Use another connector along with your medication. This is one way of saying. Did everyone follow?
Yes, ma'am.
Yeah. Then that is not over. We have another task also. Established. What do you mean by established? Meaning reassure. You have to make yourself clear. Established in Malayalam, sure okay, establish patient's understanding about his or her medications, dosage, frequency. So make sure. Here, establish meaning make sure that the patient has a right understanding of the frequency of the medication. So you can say, well, I hope you have a clear understanding of the dosage and frequency of your medication. Isn't it? Did you understand how to attempt this? Clear?
Yes, ma'am.
Yes, ma'am.
Yeah. Then I'll come to my point, okay? Then I'll say, yeah, I know what the medications, I know regarding the medications I need to take and when, but I'm worried if I'll remember to take the medication. That is my worry. That is the worry of the patient. Then definitely you have to reassure them, isn't it? How do you reassure them? That you can use something that I said before. Definitely, it is a concern. But then you can start with this task. Okay. Can someone read the task? Third task.
Recommend strategies.
Nasim, continue.
Okay. Recommend strategies for managing medication. Example, tablet organizer, reminders on his and her phone, family support, etc.
Yeah. Good. See, so where did I end actually? I said I'm worried if I'll be able to take the medications, isn't it? So don't go directly to the task.
Definitely.
Instead, give me a reassurance. How can you say definitely? It is a concern. But I shall recommend some strategies that will help you to manage your medication. Okay, so you can begin by you can begin this way, and then tablet organizer. So you can use this in different ways. Use it creatively. You can ask like, well, have you heard about a tablet organizer? You can also attempt this way. Approach this way, okay? Well, have you heard about a tablet organizer? Definitely, keeping a tablet organizer will help you to take the right medication at the right time. You can also attempt like that. Or another option is, well, I would advise you to buy a tablet organizer as you can check whether you have taken your medicines or not. And it also helps you to take the right medication at the right time. Then you can say, it is also advisable to keep reminders on your phone. And above all, Malayalam, above all, you definitely need your family support. as they can remind you about your medication. I hope you are clear about that. I hope you are clear about that. Okay, see that these are some of the different ways you can approach. Then I'll say, oh, definitely your suggestions really sounds helpful. Then I'm asking, is it okay if I take any pain relief like paracetamol as well as along with my medication? I have this doubt. So how do you respond? Can someone else attempt the task, read the task? Donna, read it.
Okay, ma'am. Advise patient to speak to the doctor on duty about pain relief. Remind patient of post-discharge management of condition. Example, if symptom get worse, contact the hospital, check up with GP, etc. Explore any other patient outcomes.
Concerns. Okay. So I'm saying, is it okay if I take any medications like paracetamol along with my medications? See, when a patient is asking this to a nurse, actually the nurse has no answer because she's not the right person to know that. Okay. So how do you say this differently? That is our job. So how can you say you don't agree with what the patient says, isn't it? So you can say, I'm sorry to give you a definite answer. I'm sorry to give you a definite answer. Instead, I would advise you, then read the task normally. I would advise you to speak to the doctor on duty regarding the pain relief medication. Did everyone follow? Next task is remind patient of post-discharge management of condition, which means you have to explain once again to them how to manage the condition once the patient is discharged. Then you have said if symptoms get worse, what's to be done? You can say, let me remind how to manage your condition after discharge. Let me also remind how to manage your condition after discharge. In the brackets, if symptoms get worse. If, another word for if, in case. Try to use synonyms like that. In case your symptoms get worse, or in case you find any complications, you need to contact the hospital for further follow-up of the checkup with your GP. Is that clear? Is that clear?
Yes,
Or occasionally you can ask, I hope you are following me. I hope you are following me. Occasionally you can ask such one-liners. I hope you are following me. Then explore any other patient's concerns. Explore meaning find out. Okay, apart from these, do you have any other concern? Students got it?
Yes, ma'am.
Yes,
Yeah.
ma'am.
Yes.
Then my reply is, yeah, I have another worry. Because what my worry is that next time I go to see the GP, I think probably my GP will not know what the treatment I had in this hospital. So what do? This is a worry of the patient, whether the GP will be updated regarding this treatment. You'll understand. So your answer to my query will be, see, read the task, last task. Okay, someone else help me.
Show patient about communication of medical information. Example from hospital to GP of patient's authorization, treatment, medication, etc. Find out if the patient has any other concerns, questions.
Yeah. Okay. So my worry is how will the GP know what kind of treatment I had? So because I don't know to update that. Then how do you say? First of all, you have to reassure that before coming to the task. You can say there is absolutely nothing to in that. See, I was trying to say something different. Okay. There is absolutely nothing to fear. There is absolutely nothing to fear regarding that? Did everyone write it down? You can down. It's not compulsory, okay? Then you come to the task. Please, it is your duty to reassure them, console them, and then come to the task, okay? Then you can say, what do you say? Reassure patient about communication of medical information, which means from the hospital to the GP regarding patient's hospitalization, treatment, everything will be done. Okay, so this is what you're going to assure. You can say, as I'll repeat once again, there is absolutely nothing to fear regarding that. I reassure the patient. I can assure you that the medical information of, use the bracket, of patient's hospitalization, treatment, and medication will be effectively communicated from the hospital directly to your general practitioner. Did you understand? Should I repeat it once again?
Yes,
Yes.
ma'am.
I can assure you that the medical information, see here, you have to rearrange what is given in the brackets. Don't read the same thing. That is what the latest OET update demands also. You have to say in your own words. By understanding the content, and you have to write, you have to rephrase it. Then you will get good marks. I can assure you that the medical information of patients, hospitalization, treatment, and medication, don't worry about that, will be effectively communicated from the hospital directly to your general practitioner. So there is no room for concern. Room. I don't know if you understand. No meaning, no chance, no need. So there is no room for concern. You see, this phrase is very difficult for you. I would say don't use it. So there is absolutely nothing to be worried about that. That is also enough. So there is nothing to be worried about that. What I said earlier is, so there is no room for concern, meaning no need for concern. Again, once again, I request you, please, students, only if you are comfortable using all these, use it. Otherwise, don't use it. Yeah. Is that clear with you all? Find out if the person has any other questions. How do you say?
Do you have any?
Lastly, oh, before I wind up, can I ask you, do you have any concerns? Then I'll say no. I don't have any other concerns. And I'm waiting, and I hope I'll be able to go home soon. And anything like that. Then what do you say? There is no task special for you, but still you have to give me an answer. Because I'm saying, oh God, I hope I'll be able to go home at the earliest. Please tell me, students, what do you all say?
Yes, definitely.
Definitely. You can go home soon.
Yeah.
And definitely we can hope for the best.
No, that is an open-ended answer. You can say like this, make it more specific and clear. You can say, definitely, we shall make arrangements for your discharge at the earliest. We shall make arrangements for your discharge at the earliest. Thank you. Raise your pitch and say thank you. Don't say thank you. It looks very dull. Sounds very dull. Did you all get an idea, students?
Yes.
I was trying to say something different than the usual style, isn't it? Because they say that nowadays everyone talks the same thing, so we should be a little different. Okay, now we're going to have a quick replay of what we did. Okay, I want everyone to at least, you have to everyone at least, some of you, and if you have said something, try not to repeat. Give others a chance. Okay, so can I have someone to begin? We are going to do a replay of what we did. See, let me tell you, I've given you some information, but don't use the same thing, okay? I would say that it is good if you all use your own style. Doesn't matter if you go wrong. See, during the preparation time, what do you all do?
We'll ask the name of the patient.
Yeah, ask me. We're going to do the replay now.
Who can I address you during the role play?
I am Anu.
Hello, Anu.
Begin.
I am Asinsa, a registered nurse working in this department here. Well, I'm here to give you a good news that you are planned for discharge today.
Mm-hmm.
And I'm here
Okay.
also to discuss about your discharge process. So before that,
Well, I'm feeling much, much better today. And I really can't wait to get back home. I'm really excited. Next person. See, please don't lose that tempo. Can you all opt and jump and say, I have so many old students with me. Quick.
oh, that's great.
Okay, say, continue.
Then the patient part number.
Yeah. No, your nurse part. Say,
Oh, that's great to know, Anu.
continue with the next task.
Yeah. Well, before your discharge, I shall explain to you some discharge process.
Okay. Continue. Then I think I'll have to call names, huh? Donna, try attempting this.
Happy to go to home. So before that, I would like to say that you have a final assessment by the medical team, after which you will receive your medication from by doctor. Along with, you can receive your medication also. Are you getting my point?
Okay. You forgot to talk about the discharge letter from the doctor. Okay. Yeah. Ani Chechi, can you help me, please? Good, good. Donna. Ani Chechi, can you explain the same thing to me?
That's great that you're happy to go home. See, but there is some procedure to be done before you go home. That is the final check by our the doctor. So he will come and reassess you again, and you have to receive a discharge letter from the doctor also. And there are some medications, so that is to be get from the pharmacy. So that's all about the regarding the procedure for this.
Okay. Good. Good. Can someone else start? Continue from where she stopped?
I hope that you are a clear understanding about the medication, dosage, and frequency. Is it clear for you?
Yeah, definitely. I know what medications I need to take and when. But the problem is, I'm really worried whether I will remember to take them regularly. That is what I'm worried about.
Definitely, I really understand your concern. But I can give you some recommendation about the good strategies for managing the medication.
Mm-hmm.
Can I explain?
Yes?
Do you heard about the tablet organizer?
No. Have you heard about? Say?
Have you heard about? Yes. Have you heard about tablet organizer?
Not really.
Okay, I will explain regarding the tablet organizer. That will be, you will give you the correct information, what time you have to take the medication. And otherwise, you can keep reminder in your phone. And moreover, you can get the support from your family. So inform your near one to remind you the correct time for the medication. Do you follow me?
Okay, definitely. I think your suggestions was really helpful. I definitely will look into that. But is it okay if I take any medications like pain relief medications like paracetamol along with my regular set of medications? What do you say about that? Next one.
I am sorry to give you a definite answer. Instead, I would advise you to speak to the doctor on duty about pain relief. Will you be able to do that?
Okay, I definitely. Attempt.
Don't accept that say.
It's okay. You attempt.
There is absolutely nothing to fear regarding that. I will assure you that the medical information.
No. It is something. It is the second last task. What you talking is the last task.
I will advise
Remind
you.
patient of post-discharge management. Say that. remind patient of? Did you understand?
No, I didn't get.
Yes, let me
Finish.
also remind.
Let me also remind you how.
Okay, say, be loud.
Let me also remind how to manage your condition after discharge.
Okay.
In case of your symptom get worse, you need back hospital for further check, and also you need to visit your GP. I
Mhm.
hope you are clear about this information.
It's not clear. There's so many students just viewing this. Can someone opt?
There is absolutely nothing to worry regarding that. I can assure you.
No. Explore any other patient's concern. Let's go step by step. Shweta Center.
Now, apart from that, do you have any other concerns?
Yeah, definitely. I'm also worried about something because I think the next time I will go see my GP. I don't know how my GP will remember regarding the treatment I had in this hospital. So I don't know what to do about that. How can you help me regarding that?
Well, Anu, there's absolutely nothing to worry regarding that. I can assure you that the medical information of patients' hospitalization, treatment, and even the medication will be directly communicated to the GP.
Mm-hmm.
So I believe there is no room for any concern. Are you
Okay.
following me?
Yes. End it.
Yeah. Before I wind up, can I know, do you have any other concerns?
See, actually, I don't have any other questions because you've given me very good clarifications. And I hope I can go home very soon.
Yes, definitely, Ms. Anu. We shall make arrangements for your discharge as soon as possible. I wish you a speedy recovery. Thank you.
Thank you. Yeah, good.